They call it septic hip, which in essence is a staph infection that settled in his hip, in the joint of his hip.
I had to go to a hockey camp, and it was hurting like really bad. And I thought that maybe it'd pass over by like the middle of the hockey camp, and it wasn't. It was just getting worse. And I went to like the nurse, and she just basically said, "Shake it off," and it hurt way too much. So I made my dad pick me up. It was scary. It felt like there was like something moving around in my leg at some points, or it was just like someone like jabbed me or something like that. I was diagnosed with staph infection in my left hip. Immediately they got me into surgery. I don't know what they did, but afterwards they put me on an IV for a couple weeks.
They needed to operate on it to clean it out as opposed to just treating it with IV, because it was in such a sensitive area that could, get on it, get into his cartilage and affect ultimately his growth throughout the rest of his life. So that's why they, immediately told us we need to head up to Lebanon and have surgery.
I knew something was wrong, so I called his pediatrician, who got him right in. As soon as the pediatrician saw him, he knew something. So he had the blood tests and x-rays, and they were thinking it was Lyme disease, which would take 24 hours. So the next morning he called the pediatrician, and I thought he was calling back with the Lyme disease, and he didn't have the results yet. He just said, "I was thinking, and I don't feel comfortable, and I have a guy at Dartmouth-Hitchcock, an orthopedic surgeon. He's going to be calling you. I've already spoken to him, and he's going to be calling you." And I said, "Oh, okay." And I hung up the phone. My hand was still on the phone. And Dr. Weintraub's office called back and got us in there within the hour. And then after he saw Shane and saw the pain he was in, Shane wouldn't even sit down because it hurt too much to sit or to stand because of his hip. And they got him right in for an MRI, and he called Dartmouth-Hitchcock up in Lebanon and Dr. Cook and got it all done, and then came in and saw me and said, there's only one guy in New Hampshire I would have do this. And he's an orthopedic surgeon himself, but he still said Dr. Cook's a pediatric orthopedic surgeon. You need to go there. And I thought, okay, well, I'll make the appointment tonight and we'll go later. And he said, "No, you need to go now, they're waiting." We didn't know what was wrong. We were thinking a pulled hip or something. So I got him, and we flew up to Lebanon, and then we got Shane into a wheelchair because he couldn't walk. He was hysterical, crying, couldn't walk, was in so much pain. I'm hysterical. And I came walking into the lobby, and there was a young man who works in admissions who was standing there, and he said, "This must be Shane." And I immediately just felt just like a calmness.
But Dr. Cook and everybody up there was just great about explaining to us, A, what he had, but B, what they were going to do about it, and what the recovery was going to be like. So the whole process from getting him at camp to getting him back up to Lebanon it was a whirlwind, but it was just seamless from our end. Dr. Cook came out, post-op, and he told us everything, was great. I mean, it's, explained to us exactly, look, the fluid in his hip joint is supposed to be clear, and, what we expected, we found when we got in there. It was a whiskey color, it was infected. We cleaned it out, we got it all out, and, that was it. So he, gave us a little bit about what to expect, kind of, from a recovery point of view. And then we got to go see Shane as he was waking up, and he immediately said he felt better. I mean, just the fact that he didn't have the infection in him anymore, at least in the hip joint. It was still in his bloodstream, but he immediately felt better in post-op, and
He was a different kid.
He was a different kid immediately, which, he's back to kind of being himself.
It's amazing to think that, child presents here in Nashua, and even though we're spread apart by miles, the community group practices and DHMC, we're actually very tightly connected and intermingled, and the patient really benefited from that close connection that we have, the collaboration that we have, not only as providers, but also with all the technology that the organization has really brought to the community group practices.
Having Shane's post-op care be in Manchester was huge for us because we live in Merrimack and we didn't want to have to travel to Lebanon every day. So the flexibility of having a Manchester location, 20 minutes from the house was, great for us because it just saved us commuting time. And, Dr. Cook has his office hours on, a couple days a week down there. So we were able to coordinate seeing him, the same doctor that operated on him, which, was important to us.
And also we were, the week we were at the beach, we didn't have to take 2 days off from the beach to go up to Lebanon. We could just, the appointment was at like 11, and we left at 10, got there for 11, and was back at the beach at noon, so.
It was important that he saw he was getting better, we saw he was getting better, and each week we saw marked improvement to the point where, after I think 4 or 5 visits, he was fine. You can get the PICC line out, and that, immediately, he had about a week, maybe a week and a half left in his summer, so he wanted to do everything in a week and a half.
I'm so happy that I got better because now I can play hockey, lacrosse, swimming, and basically everything.